Hi, I'm Morgan, and today I'm going to be testing cervical rotation on my patient, active range of motion. And first, I'm going to have him perform the rotation on his own. So go ahead and look to the left. All right, go ahead and look back. Now look to the right. Good. Now I'm going to measure his range of motion. All right. Okay, so I'm going to take the fulcrum of my goni and I'm going to place it on the superior surface of the center of his cranium. I'm also going to palpate his acromion, and that's going to be where the stationary arm is going to be, and the moving arm is going to be parallel with his nose. All right, go ahead and look to your right for me.
Oh, you're fine.
Lining it up with the nose again. All right, it looks like he is about 68 degrees of range of motion there. I'm gonna have him return back to neutral, and I'm going to flip the goni around so that the stationary arm lines up here with his acromion, which should be right about there. Fulcrum is in the same spot. All right. And moving arm is parallel with the nose. Go ahead and look to the left. All right. And he has about 61 degrees of motion on the left side. So normal range of motion for cervical rotation is about 60 degrees, so he's pretty normal. But if he was limited, some things that could be limiting that would be in terms of the joint, the apophyseal joint, vertebral arteries, and the alar ligament. The muscles that could be limiting his range of motion could be the sternocleidomastoid, the upper traps, your scalenes, levator scapulae, and suboccipital. Okay, now I'm going to be performing a manual muscle test for his shoulder abduction. And first I'm going to have him do it, the shoulder abduction actively on his own. Sir, if you could go ahead and raise your arms above your head like this, with your thumbs facing up towards the ceiling. Okay, and bring it back down. Do you have any pain with that?
No, ma'am.
All right. So that was a 3 out of 5 because he was able to do that full range of motion with no pain. So now what I'm going to do is have him bring his arm out to 90 degrees, and I'm going to test his mid-deltoid and his supraspinatus by pushing down with min-mod max force. All right, so I'm going to go ahead and stabilize his shoulder. I'm going to be pushing force down through his distal humerus. Okay, I'm going to push down on your arm. I want you to resist me by bringing your arm straight up. Don't let me break you. Ready? All right, so he was able to resist min, mod, and max resistance, so that is a grade 3 out of 5, or 5 out of 5. Now, we would also test this bilaterally, so I'm gonna have him do the same thing, 90 degrees straight out, stabilize the shoulder, resistance goes through the distal humerus. Ready? Okay, now I'm going to be testing my patient's shoulder abduction. First, I'm going to have him perform this motion on his own actively. So if you want to go ahead and raise your arms both up above your head like this, thumbs facing up, good job. Go ahead and bring it back down. So that right there is a grade 3 out of 5 because he was able to do the active range of motion on his own. So now I'm going to be testing my patient's scapular adduction and downward rotation with a manual muscle test. So first I'm going to have him do active range of motion on his own to grade whether or not he can do it with or without gravity. So sir, what I'm going to have you do, I'm going to have you raise your arms out straight to your sides like this, up off the table, good job, you can left drop them. All right, so it's a 3 out of 5 because he was able to perform that with no, wasn't painful, was it? He was able to perform that with No assistance and no pain. So now what I'm gonna have him do is on the opposite side of me, I'm gonna have him lift this arm up off the table, and I'm gonna stabilize the other shoulder. I'm gonna push into your shoulder blade. I'm gonna try and push it up and out. Don't let me do that, okay? Ready? Min, mod, max. All right, and when you're doing that, it's important to make sure that you're pushing with more of like the medial surface, the meaty portion of your hand, so that it's not bone on bone and you don't hurt the patient. So because he was able to go against min, mod, max force, this would be a 5 out of 5 on the grading scale. Also, this manual muscle test is testing the rhomboids, both major and minor, which are innervated by the dorsal scapular nerve, which comes from C5. Oh, and then you would also test bilaterally to make sure that he has strength on both sides.